Generally, induction means to start. Induce means to help something to start. I don't know if you understand. So induction is a medical treatment to a pregnant woman where you use either a drug or mechanical means to cause the labor to start. And there are some conditions at which you do induction. One of those conditions where you do induction, which is the commonest indication for induction, is someone whose date has actually passed. Okay? I said earlier that we should know the date for ultrasound that was done before 5 months, or when that woman is very sure of her last menstrual period. For example, a woman come and tell you that her last menstrual period is on 25th of December. That was the last time she saw it. You are not likely to argue her. There are some special dates that when a woman tell you that she saw her menses on this day, agree with her. She saw it on that day. I don't know if you understand. There are some women that will come. When they come to see the nurse will ask them. They will just say, or maybe we saw it on 18th of January. Once the book reaches your table, you look at what she has answered the nurse. You still ask her, when did you see your menses last? Because you were not there when the nurse asked. You still ask your own. They can come and tell you 19th or 20th. Once they tell you something different from what they tell the nurse, she might actually be lying. But if she tells you the same thing from what she told the nurse initially, it's possible that she is saying the truth. But once that woman is very sure and can convince you that she is very sure of her last menstrual period, that is likely to be right. We can work out her expected day of delivery from her last menstrual period. And once we are sure of the last menstrual period and that date has come and gone, usually we give another 6 days. So assuming that her EDD from her last menstrual period or earlier ultrasound shows that her expected day of delivery is today, okay? We'll just give her another 6 days, which is next Sunday, okay? By next Sunday, if labor did not start on this own, we can now start her on induction. So induction can be done with, usually we use drug, which we usually put in the vagina. Sometimes we can put it under the tongue. That is induction. It's just a medical way of starting labor. This labor did not want to start. We just want to start it. It's different from augmentation. Augmentation means that the woman is already in labor, but the labor is not moving as fast as we want. I don't know if you understand. She ought to have delivered, or the contraction suddenly stop going as fast as it's going. We will now do augmentation. Augmentation is what people usually call hot injection. Okay, we put it in the drip, Ojiwa Yanaba, to increase the force of contraction so that the woman can actually deliver. But there are some contraindications. There are some conditions at which we don't do induction. We don't equally do augmentation. One of those conditions is that if the woman has been operated on before, and that operation touches the womb, either fibroid or CS, and we know that the womb has been cut before, then that woman is not a candidate for induction. She is equally not a candidate for augmentation. So if a woman has done CS before, and her date has passed 40 weeks, we still give another 6 days, and she's not able to enter into labor. Sometimes we do what we call cervical sweep. We go and sweep the cervix or put a catheter and dilate it and see if she will enter into labor herself. The idea is that if she starts that labor on herself, the womb cannot give itself more force than it can handle. I don't know if you understand. But if you give an exogenous source, like you give a misoprostol, or you go and give a hot injection, that hot injection can give that womb power bigger than what the womb can actually control. And once that happens, the womb is likely to rupture. So to avoid the womb rupturing, what we usually do is that we avoid induction, we avoid augmentation in a woman that has been operated on before, especially when that surgery touches the womb. But if a woman has had something like ovarian cyst before, or she have had something like appendectomy before, or she even have a major surgery, maybe intestinal obstruction, and that surgery did not touch the womb, we can still induce her, we can still augment her. But we talked about that we don't induce or augment only when there is injury to the womb, that the womb was cut.